I'm going to talk this morning about a fundamental exercise which is used in weight training. It's called the deadlift, and it's often seen as an exercise which is used in bodybuilding, in powerlifting. You'll see a lot of professional athletes using this. We're going to look at the traditional classic deadlift, and then we're going to split it up into different components so that we can see the advantage of the movement for rehabilitation and how we can progress from relatively early stages to more advanced stages moving into the classic lift itself. So the deadlift action is one where we come from a wide stance and we bend at the knee and the hip, and we reach down and then come back up again. So we're keeping the back relatively straight. And what we're doing with this movement is combining a movement and a loading at the ankle, the knee and the hip, as well as maintaining the alignment and the stability of the trunk. And there are advantages and disadvantages of that. But the fundamental principle behind this lift is that we're combining actions in what's known as the posterior chain, which is all the muscles and all the tissues on the back of the body. So calves, hamstrings, glutes, erector spinae, shoulder retractor muscles. So let's set up for the classic exercise, talk through that, and then see how we can change and modify that exercise for different needs. And we're thinking particularly of rehabilitation for low back pain, for hip pathologies, and for hamstring injuries. So all of those are affecting or looking at clinical conditions affecting the posterior chain. So let's start up with our classic deadlift. So we've got our Olympic bar, which is a 7-foot bar. We're using bumper plates, and bumper plates are solid rubber, so they make slightly less noise on the floor. I'm also using lifting straps, and lifting straps just give you the advantage of a slightly fatter grip and you don't slide as much. But they're not necessary, but just to mention what they are. So let's have a look at the lift itself and then we'll talk through it. So you notice that I'm standing with my shins just a couple of inches behind the bar, and as I come down, I'm using the lifting strap. The strap goes around and I then wind the bar around it. So straps onto the bar, feet facing forwards rather than turned out completely. Get into my position. Once my shins are at the right position, I drop my hips down into what's known as the set position. So I'm looking up and I'm drawing my shoulder blades back, and then all I do is, rather than snatch the bar from the floor, I press down with my heels. So my toes, I can wiggle my toes slightly so my weight is in the whole of the foot, but particularly emphasised on the heel. So in front of the bar, press, and then back. So that's our classic deadlift performed with an Olympic bar. Let's see how we can modify that now for those who don't want that sort of resistance. So I've lifted the bar further up now, so I've got a smaller bar, much lighter bar, padded aerobics body toning bar. And what I'm doing is coming down into this position, rather than taking the bar from right from the floor, I'm taking it from knee level. So I'm just coming down and I'm moving into this position. So I'm really focusing now on the first part of the movement. And I can modify this. So if I want to perform the movement with a focus on the hamstrings, I can lock my knees out and perform a deadlift with rigid legs. So what we call a straight leg deadlift or a fixed leg deadlift. I can focus on bending the spine. So if I want to work on the focus of working the erector spinae, I can keep the legs straight and I can actually bend the spine down. So I'm now performing a limited range Jefferson curl rather than a stiff leg deadlift. So that's my rounding spine Jefferson curl, flex the knees slightly, keep the legs rigid, and that's my stiff leg deadlift. So I'm modifying those movements by increasing the height and focusing on one or other of the actions. We can also change things slightly by working on the alignment. So if you find it difficult to coordinate movement, you can pop your hands front and back of the spine. And all I'm doing now is starting with my pelvis in normal alignment, so my hands are facing downwards. And all I do is flex my knees and hips and point my hand at the skirting board. So all I'm doing now is focusing on getting that pelvic tilt, getting that movement. And once I've got that, I can then move down into the movement. So I'm now focusing on the hip hinge movement, which is a combination of this action, pelvic tilt with the spine straight, and sinking down. So you can see that I'm keeping my body relatively upright to do that movement. So simple broom handle here. If you find it difficult to perform that action, just align the broom handle along the spine. So it's touching the head, it's touching the shoulder, and it's touching the tailbone. And the action now is to dip down on the hips and knees, but to angle forward to 45 degrees, keeping the spine on the broom handle. And if you find that you're unable to keep your spine straight, either this will happen, so your hand will leave your spine, or this will happen, so I'm overly hollowing my spine. And I want to keep that contact between head, shoulders and tailbone as I come down to my hip hinge movement. So for my final action then, I'm just using dumbbells, and we can perform this at home, and we can just use a straight dip down with our dumbbells. So it's a dumbbell deadlift, so all I'm coming down is coming down to knee height, or further down to shin height, or I can come all the way down into a deep squatting position with the dumbbell on the floor. I can modify that with the exercises that we've used. So there is the stiff leg deadlift using my dumbbells. There is the Jefferson curl using my dumbbells. And that action can be modified still further with a single movement. So we can modify and perform a lifting action. So our squat lift movement is actually a deadlift. So all I'm coming down is reaching down for the dumbbell, touching it onto the floor, coming up. So I'm keeping my back relatively rigid, and I can use a goblet squat for that movement. So I'm coming down here, I've got my elbows tucked in, my forearms either side of my dumbbell, and I'm moving down to my elbows come to my knees. So that focuses me on the squat part of the action. Or I can move into a stoop lift action where I'm bending my spine, and that's our Jefferson curl. So I'm coming round, getting a good bend all the way through the spine, coming up again. So my legs are either straight or slightly flexed and stiff. So I've got stiff legs for my stiff leg deadlift, and I'm allowing my spine to bend. So you mustn't be afraid of bending the spine. The spine is meant to bend, and your spinal erector muscles will straighten the spine. So as you come from a bent position to a straight position, that's their function. But what we're trying to do with our deadlift action and also our hip hinge movement is to overcorrect. So we're saying, well, okay, if a person is bending too much at the spine and they're not able to get that deadlift action, what we'll try to do is overcorrect the movement. So we say, well, just for a couple of workouts, let's keep that spine dead straight and focus on movement of the hip. Movement of the hip will build up the glutes, work on the hamstrings. But our classic deadlift action is done with the spine as straight as is possible, or as straight as is reasonable at least, so that we're working for the core stabilizing muscles front and back of the spine, focusing on those large muscles which are our gluteals, because that's where the power is coming from. So glutes and hams providing the power, spine delivering that power to where we need it, which is on the shoulders. Okay, so that's the classic deadlift action with modifications, with using lighter bars, higher levels and no bars.